We started COVID-19 vaccination in Singapore in end 2020, and we continue to make steady progress with our vaccination program. As of 9th May, about 1.8 million individuals have received at least one dose of the vaccine, and of which about 1.2 million individuals have received their second dose and completed the full vaccination regimen. Take-up has been encouraging. About 2/3 of eligible persons aged 45 and above have received COVID-19 vaccination or booked their vaccination appointments. However, we need to continue to encourage more to be vaccinated, especially among the seniors. Given their age, they are the most vulnerable. I urge all of us to encourage our elderly family members too. We will be inviting subsequent age bands to receive vaccinations from the later part of May. However, as vaccine supplies continue to be limited, vaccinations will be progressively extended in smaller age bands. We thank everyone for your patience, and if vaccine supplies arrive as scheduled, we will complete the vaccination program by the end of this year. So I spoke about vaccine effectiveness earlier. We knew from the start that vaccine breakthroughs are possible. But vaccination will still significantly reduce the chances of infection. For example, based on a study published in Lancet, Pfizer vaccines can reduce risk of asymptomatic infection by 91%. Vaccination also prevents severe reactions to infections and is likely to reduce onward transmission. Locally, as of 10th of May 2020, 30 locally fully vaccinated cases tested positive for COVID-19. There were another 24 imported cases that were already vaccinated. Most of our local cases of infected vaccinated individuals were asymptomatic. None had severe COVID-19 disease requiring more intensive care. This is consistent with the international experience and emerging evidence that vaccines are highly efficacious in protecting against severe COVID-19 disease and likely to reduce the risk of transmission. There's also a question on reinfected cases, which is known to be possible from overseas and local experiences. As of 10 May 2021, 26 cases have been assessed to be reinfections. We are still investigating whether these are due to the general waning of immunity over time or the lack of cross-protection against specific variants of COVID-19 that the individual is naive to. We will provide an update when we know more. Overall, the benefit of Pfizer, BioNTech, and Moderna COVID-19 vaccines continue to outweigh the known risks, and we must continue to encourage Singaporeans to be vaccinated. One area of concern is the emergence of new COVID-19 variants from time to time. There is intense ongoing global scientific evaluation for these variants, which our experts are also participating in. The current global consensus is that COVID-19 vaccines that have been approved can provide protection against these variants because these vaccines elicit a broad immune response involving a range of antibodies and cells. We will continue to monitor development in this area and assess whether our vaccine program needs to be adjusted. Members have also asked about vaccination for children below 16 years old, people with mild allergic reactions, and the need for a third booster shot. Pfizer, BioNTech, and Moderna are currently only approved for use in persons aged 16 and 18 years old and above, respectively. The initial data provided by Pfizer, BioNTech, and Moderna at the time of the pandemic special access route interim authorization did not include data regarding their use in younger populations. The Health Sciences Authority has been examining the supplemental data that have since been submitted for the Pfizer vaccine to assess if the vaccine meets safety and efficacy requirements for authorization under PISA for use in adolescents aged 12 to 15 years. HSA will also do so for Moderna vaccine when data is submitted to them. We will share more details when the studies are completed. As for children below 12 years of age, clinical trials are still ongoing and may take more time before enough data is available. Mr. Gerald Giam asked if patients who experience mild allergic reactions from the first dose can take their second dose. Persons who have been assessed by a doctor to be allergic to the first dose of COVID-19 vaccination are currently contraindicated from the vaccine and should not continue with a second dose. We understand that individuals who cannot be vaccinated or who cannot complete the vaccination may be concerned that they are not protected from COVID-19. These people are kept in our records, and we will inform them when there is a suitable vaccine for them, or when new evidence that shows that current vaccines can be administered to them are available. At the same time, as more of us are vaccinated, we also protect them indirectly. As for booster shots, data on the need of it is still emerging from both international and local studies. We will share more when we know more. Meanwhile, get the first 2 shots first. The HSA and Expert Committee for COVID-19 vaccinations will continue to monitor ongoing studies in areas such as the extent to which vaccines can prevent onward transmission, the durability of protection provided by vaccines, and the effectiveness of vaccines against emerging variants of concern, and will provide updates when available.